name is James Gervais, and I'm an associate sales rep with Wright Medical. And I'd like to thank you for giving me a few moments of your time today to talk to you about AlloMatrix injectable. A little history about Wright Medical. We were started in 1950 by Frank O. Wright. He had $300 and a dream to design and manufacture a better solution for leg cast walking heels. And through the years, Wright Medical has become a premier extremities and biologics company with a commitment to delivering innovative solutions that really improve the quality of life for patients. With the active lifestyles we have today, injuries are inevitable. I've been there, done that, cycling, broken wrist, long story, especially fractures and non-union fractures, which ties into this study I want to talk to you about by Ross Wilkins and Cynthia Kelly on AlloMatrix, particularly on non-union long bone fractures and surgical interventions for tumor and space occupying lesions. Now, the study comprised 76 patients. 41 were for the benign tumor, and 35 were for the long bone non-unions. Now, the outcome of the radiograph evidence showed that 85.1% of the long bone non-union patients had average bone healing, and the benign tumor patients 93%. The takeaway from the study authors was that AlloMatrix was consistent historically with autograft results for the same procedures. AlloMatrix injectable is an 86% demineralized bone matrix and small cancellous chips, and is combined with a calcium sulfate carrier. Now, this results in an osteoinductive biocomposite providing desired handling and fluid resistance. The putty is provided in powder form, and this is to preserve its bone morphogenetic activity until the point of use and facilitates 5 years of shelf life, actually. DBM material has been successfully used for decades in a safe and compatible alternative to autografts. And the benefits of using AlloMatrix injectable is there is no donor site morbidity. It's quicker OR times, greatly benefits the patients who are older, and AlloMatrix is cost effective and it's easy to use in the OR. Now, being a DBM biocomposite with surgical grade calcium sulfate, AlloMatrix provides optimal characteristics for guided bone regeneration that is rapid, reliable, conductive, inductive, malleable, and resistant to fluid irrigation. Now, as kind of a side note, there are a few other products in the AlloMatrix family, particularly AlloMatrix DR, AlloMatrix C, and AlloMatrix Custom. I'd be happy to go over those with you at a later date when you have a bit more time. And kind of just to circle back a little bit to the Wilkins and Kelly study and kind of drive home what they were talking about. And now it showed, particularly in the long bone non-unions, that patients' average bone healing was again 85.1%, and it was historically consistent with autograft procedures, and that AlloMatrix was reliable, rapid for the endochondral ossification. Now, AlloMatrix has been used successfully, in many surgical applications for defects of the extremities and pelvis, which may be surgically created, or defects from traumatic injury. Like I said, crashing and burning on a bicycle. First-hand knowledge of that. Now, I know you're really busy, and I'd like to really thank you for taking the time today to listen to me talk about AlloMatrix and the study from Wilkins and Kelly. I'd like to leave the more information about AlloMatrix with you, and actually a copy of the study, so you could, when you have a moment of time, you can look through it. And again, thank you for meeting with me today.